L4, L5 disc bulge explained, from pain to permanent relief. Dealing with chronic and persistent lower back and leg pain from an L4, L5 disc bulge can be concerning. And in this video, I'm going to explain the major symptoms of an L4, L5 disc bulge, plus reveal one of the most hidden and overlooked causes of an L4, L5 disc bulge. If your MRI report says you have an L4, L5 disc bulge, and you have tried all sorts of therapies and remedies with no success, then missing even one part of this video could be the very reason why you continue to delay your recovery. Also, be sure to watch to the end of this video because I will share with you my simple method for finding relief of your back and leg pain at home through a concept called Antalgic repositioning. Hi, I'm Dr. Ruminder Birk, a chiropractor in Woodbridge, Ontario, Canada. With over 24 years of clinical experience, we have helped thousands of patients recover from spinal conditions like disc bulge, disc herniation, disc degeneration, lumbar stenosis, sciatica, and radiculopathy using our unique and proven back-to-life method. Before I dive in, I need you to hit that subscribe button. If you want more tips on how to get relief at home from sciatica and disc-related pain and what therapies actually work for these conditions. Also, tell me in the comments that you subscribed and I will personally reply back to you. If you tried therapies and treatments for your disc bulge, like physiotherapy, acupuncture, anti-inflammatories, muscle relaxants, injections, or massage, and they have failed you, meaning you still have leg pain, numbness and tingling, or lower back pain, I understand your frustration. I want you to know it's not your fault. Or even worse, you were told by your doctor or therapist nothing's wrong or nothing can be done. Well, that's not always true. There is hope, and there are non-surgical conservative treatment options that are proven to work for healing of an L4, L5 disc bulge condition. Before I dive into these non-surgical treatment options, let's first talk about the one hidden cause of an L4, L5 disc bulge that is often overlooked by medical doctors and physiotherapists, and that is spinal misalignments, also known as vertebral subluxation. So the most important cause of disc problems in our office, and the way that we see this, is the vertebral subluxation. So the concept is this, that the vertebrae in our spine are what are around the cushion, which is our disc. Bones moving are, of course, what we want in this situation. The fluid coming in and out of the disc maintains the height of the disc. But subluxation is when these vertebrae have become locked and misaligned. So what causes this? This can be micro traumas over time, when we're talking about work, when we're talking about our sports, when we're talking about different things that we do at home around the house that are causing stresses mechanically on our spine that begin to lock it up. That's what we call the final straw effect. It's a buildup, a progressive buildup of problems that leads to the vertebrae locking. The other kind are big bangs, right? We call that the big bang effect. Things like a car accident, a fall on a tailbone, on slip and fall on ice, countless ways that we have a sudden lifting of luggage out of a car. All these things can be sudden traumas to our spine. So when it comes down to what that does is it leads to vertebrae locking and misalignment. And now obviously that cartilage is not getting the fluid exchange that it needs. So this is a degenerative process, right? So when we have subluxation remaining for a while, we've got that disc compressing, bulging into the nerves that come out of here. And if it doesn't get corrected properly, if you don't get treated, if you don't do the things at home that can help this, you're going to get into a situation that's more degenerative and permanent. So as this disc is decayed too far, even herniations occur, and it just gets worse from there. So these are the causes as far as subluxation and disc decay, we call this, over time. The symptoms that this is going to present with is obviously at that level. When we're looking at L5 in this case, L4, L5 disc bulge, it's going to cause the sensations that we may get locally in our back, into the glutes, into the muscles here where the nerves run under. This is called the piriformis muscle. And then it spreads, right? The further it goes down the leg, you know it's getting worse. It's obviously getting further away because the pressure is increasing at the root. At the subluxation level, the spine is causing more and more pressure down. And then we get into numbness, tingling, radiculopathy. Foot drop means that the foot doesn't even function anymore. Lack of abilities to sit, and drive and all the things that we're seeing in our lifestyle. So that's really what it comes down to, is the symptoms when we get these pressures at the disc level. You may have tried different types of therapies or remedies, like I mentioned earlier. I want to now introduce you to a treatment combination that has worked well for our disc bulge, disc herniation patients. It's a combination, a back-to-life method of corrective chiropractic adjustments, spinal decompression, home stretches and exercises, even corrective devices that fix posture disturbances that cause these symptoms. And we use a variety of machinery, whether it's cold laser, vibration tools, arthrostim adjustment tools that can get back to the corrections that we need to make in your spine. Now I want to give you a great technique that may help you get immediate relief of leg pain and back pain caused by the L4-L5 disc bulge. It's called Antalgic repositioning. So what is Antalgic position, first of all? Really what that is when you're sitting in a position that provides relief. So whether the disc has gone to the left side or the right side, you're going to find that leaning away from the side that the disc is bulging or herniated at is going to provide you some relief positionally, right? So when you're sitting and you're leaning to your right, that means most likely the disc is on the left. So if that's the position that provides you relief, we want to stimulate that in a way that brings you back to neutral, so that there's some mobility coming back to your disc. So Antalgic repositioning, let's say the person is leaning to the right? So if you find yourself leaning this way, obviously there's a pressure that you're trying to relieve, but I do want you to get some mobility back into your hips before those muscles get contracted like that. And then of course it just continues to worsen. So at home, what we can do is to just get some mobility in. If you're comfortable, if it's not causing you pain, first of all. If there's pain, I don't want you to do this, so keep that in mind. What we're going to do is we're going to find a wall. We're going to lean up against that wall. Let's say you're positioned this way. I want you to lean into the side away from the comfort level here. So gradually, 20 times, you would just bring your hip towards the side that is away from the Antalgic positioning. That's why we're calling it repositioning. So you've leaned this way. We're going to lean on the wall with the left arm in this case, and just sway your hips to get that movement restored into your pelvis, into your lower spine muscles, just to give some flushing effects to the spine. This way we're getting some motion restored, and see if that provides you relief. The other end of Antalgic positioning is actually when you're lying down. Let's say we're leaning to this way to the right. You can find that position potentially in bed and angle your legs to the left to help you get comfort to sleep. Whether you use pillows under your knees, that's a great idea at that point. Just takes pressure off your lower spine in a good sleeping position, Antalgic position. Now it's your turn. Tell me about your disc bulge condition. What types of treatments have you done for it? Did you get an MRI study done? What did it tell you? What statements worked for you and treatments did not work for you? Let me know in the comments below. If you found value in this video, be sure to like it and to share it now. And go ahead and subscribe to my channel now if you want more tips on how to relieve sciatica and disc-related pain and what treatments actually work for L4-L5 disc bulge. Now, the next video you should watch is this one. You will learn how to use whole body vibration in our protocol in the treatment of chronic spinal conditions of L4, L5 disc bulge. Watch this video right here.